Good morning, friends. After the erectile dysfunction, patients have failed many treatments and finally they are deciding for penile implant. One question comes into their mind: which would be the best implant for me? I am Dr. Ashish Sabharwal, urologist, andrologist, and robotic surgeon from New Delhi, India, and today we will discuss the various types of malleable implants and I will help you choose what will be the best implant for you. Today we will discuss the three types of malleable implants: the Indian malleable implant, the Tactra implant by Boston Scientific, and the Rigicon Rigiten implant from USA. First we will discuss the Indian implant. Indian implant is by far the most commonly used malleable implant in my practice. Many patients choose this implant and the main reason for choosing the Indian implant is the low cost. The cost of the Indian implant is 1/10 the cost of the American implants. So because it is cheaper, many patients go for this implant. Let us discuss about this Indian implant. See, this Indian implant has got 4 parts. It looks like a single rod, but there are 4 parts in it. The distal tip, which is soft, then this is a distal area which is hard, and then this is the hinge part which is again soft, and this is the back part which is the proximal portion which is again hard. The soft tip is for having a comfortable intercourse. The hard part fits in the penis to give a hard erection. This is the soft part which is the hinge, which is at the junction of the body and the penis, and this is the hard part which gives stability for the intercourse. There are 2 things I will discuss about the Indian implant. One, the rigidity, and the second is the concealability. So regarding the rigidity, this part which is the hard part which fits in the penis is quite hard, and the hinge which is the soft part is just behind it. This hinge has an important role in the rigidity. See, when we press the Indian implant like this hard part gives good rigidity for intercourse, but this soft part which is a hinge, it bends a little bit. You see, like this. So with the Indian implant, if you are planning for aggressive intercourse like woman on top position or anal intercourse, in those actions the Indian implant might not support you. The second part is because of the hinge, the direction of the Indian implant inside the body is little bit downwards. So it is not a problem, but when you have intercourse you have to lift it and then insert the penis. The third point is that the Indian implant is not very good for the penises which are longer than 6 inches, because in penises longer than 6 inches it does not give enough rigidity. Secondly, about the concealment, this hinge part can be bent easily in all directions, so the Indian implant can be easily concealed under the clothes, but it has got no memory. So as soon as we release it, it springs back. So as soon as you remove your clothes, it will spring back. But in spite of all this, if cost is a concern, then at a lower cost with the Indian implant you will get a reasonable hardness and an excellent concealability under the clothes. Now, if cost is not a constraint, I would definitely recommend the American malleable implants. That is either the Tactra or the Rigicon Rigiten. First of all, we will discuss the Tactra implant. See, the Tactra implant, the main benefit of this implant is it has got excellent rigidity, excellent hardness. So if you are wanting an implant for aggressive intercourse and you like your partner to be on top of you, so you want a woman on top position, or you want to do anal intercourse and you want a good rigidity for that, so in those cases Tactra implant is the best. The hardness of Tactra is much higher than Rigicon Rigiten or the Indian implant. But because it is so hard, a minor drawback is that the bendability is less. So you see, when we bend it, it is bending, but it is not bending 90 degrees, it is bending slightly forward. So bendability is there, but it is not vertical 90 degrees bendability. So it is a very good implant for rigidity. But if you're a person who says that rigidity is acceptable, but I want an implant which should have excellent concealment and it should have 90 degrees bend, then Tactra is not the right option for you. The better option is the Rigicon Rigi-10. So you see this implant, this is the Rigi-10. When we bend this, it goes 90 degrees. So this type of concealment is better in the Rigicon implant as compared to the Tactra implant. But because it is so bendable, the rigidity is lesser. You see, it is bending. So I have seen that some of the patients have initially opted for Rigicon implant because of the concealment, but they are not satisfied with the rigidity, and then they later on change over to the Tactra implant. So to make things simple, if you are thinking of an implant which should be affordable and not very expensive, Indian implant is the best. If you want an implant which should have excellent rigidity, then Tactra implant is the best. And if you want an implant which has maximum concealment, then the Rigicon Rigi-10 implant is the best. So now I have discussed with you all the advantages and disadvantages of all the three implants. Many patients tell me, sir, you have given us all the information and now I am even more confused. Which implant is the best for me? What implant would you recommend? So friends, if you want me to name one single implant out of these three, based on my experience and what the patients have given me feedback about their satisfaction, about their quality of intercourse, if you ask me which implant is the best of all the three, I would tell you that Tactra implant is the best of all the three of them because it gives excellent rigidity and quality of intercourse is very good. And when somebody is having an erectile dysfunction, the most important thing is that they should have a good intercourse, and that type of thing can only be guaranteed by the Tactra implant. So friends, I hope this video was helpful for you. If you're also an erectile dysfunction patient and you're planning to do a penile implant surgery, you can contact me by email or WhatsApp. My email address and WhatsApp are given in the description. Thank you.